Welcome to the Deep Dive. If you've noticed how fast technology is changing pretty much everything in our lives, well, you've probably felt it in healthcare too. It's so personal, so critical. And this idea of a digital doctor or maybe a smart hospital, it really doesn't feel like sci-fi anymore, does it? It's happening now, evolving really quickly. So today we're doing a deep dive into this fascinating world of digitalization in medicine. We're going to be unpacking a pretty hefty bibliometric analysis. It's called "What is the Current Status of Research on the Impact of Digitalization in Medicine?" A bibliometric analysis.
Yeah.
Yeah, quite a title. It was published by Badareu and colleagues just back in January 2025. And our mission for you, the listener, is, well, to cut through all that academic jargon. We want to pull out the really important nuggets from this big study. Think of it as like your shortcut to getting genuinely up to speed on where digital health is at globally. We'll look at the who, what, and where of it all. Expect some surprising facts, enough context to keep you hooked, but hopefully not too much to feel overwhelmed. But maybe first things first.
How does this study actually define digitalization in medicine? What are we talking about here?
Right, good starting point. So essentially, they define it as this really profound process of integrating and using advanced digital tech. We're talking things like telemedicine, AI, big data, those electronic medical records, EHRs, you often hear them called, and also interoperability systems. The whole point is to fundamentally transform and hopefully improve how healthcare services are delivered. So the core goal is really boosting efficiency, making healthcare more accessible, and improving the overall quality of care. It's about weaving the digital age into, well, every part of health.
Okay, let's unpack that then. Looking at the big picture, how has the academic world actually reacted to this huge shift? Has research into digitalization in medicine always been, buzzing like this, or is it more recent?
That's a great question, and this study maps that out really clearly. If you look at the publication trends before the 2000s, growth was pretty slow, actually. The number of papers stayed relatively low, kind of constant. They were mostly laying groundwork, fundamental medical concepts, not so much direct digitalization stuff. It was, a field just getting started.
Right. What sort of foundational ideas were they exploring back then? Stuff that was maybe crucial for what came later.
Yeah, mostly it was about data management concepts, early computer applications in medicine, figuring out how to organize information, how to access it, really just setting the stage. But then after the 2000s, things changed. Information technology, the internet becoming widespread.
Yeah, that must have been a huge catalyst.
Absolutely. The number of publications started growing, quite notably. We started seeing digital integration of medical devices, new tech like AI popping up, opening whole new perspectives for diagnosis, for personalized treatment.
So beyond just having internet access, how did the internet specifically change the type of digital health research that they could even do then?
Well, it enabled network systems, didn't it? And remote communication in ways that just weren't possible before. That's when we saw the first sort of telemedicine platforms emerge. And managing electronic health records, EHRs, on a bigger scale suddenly looked feasible.
Okay.
And then from 2010 onwards, it's just been a steady climb, a real increasing trend. This was pushed by, more emphasis on digital transformation, remote monitoring, analyzing medical data. But here's where it gets really interesting. The period from 2020 to 2024, it just stands out.
Yeah.
A massive output of papers, peaking in 2022 with almost 500 publications in that 1 year.
Wow, nearly 500. That's a huge jump in just a few years. What kicked off that boom, especially around 2020?
Well, it seems like a few key things kind of came together. First, and maybe obviously the COVID-19 pandemic, that was a massive catalyst.
Right, yeah.
It just accelerated everything. Implementation, research into digital solutions like telemedicine, remote monitoring, mobile health apps. It became a necessity, with lockdowns and social distancing. Healthcare had to adapt fast.
Necessity really driving invention there.
Couldn't agree more. And second, just sheer technological progress played a huge part. AI and big data development meant we could suddenly analyze huge amounts of clinical data really quickly. That leads to more accurate diagnoses, more personalized treatments. And we also saw a growing interest in robotics, automated solutions, especially around 2022, 2023.
Okay.
And third, there's just more global interest. Challenges like aging populations, rising rates of chronic diseases, they really highlighted the need for effective digital solutions that can, scale up and improve efficiency.
So it wasn't just more research. the actual definition and scope of digital medicine must have changed too, alongside that explosion in papers.
Absolutely. Before 2000, like we said, mostly conceptual stuff, theories, not much direct clinical application, mostly basic data management access. Then, 2000 to 2010, digital tech started getting integrated into actual healthcare systems. It moved beyond just managing data to helping with diagnosis, treatment, things like early telemedicine, EHRs becoming more common.
So moving from theory to the first real steps in the clinic.
Exactly. And then after 2010, with AI really taking off, the Internet of Things, connected medical devices and big data analytics, digital medicine just expanded massively into preventive care, advanced diagnostics, really personalized treatments, remote interventions. Now, today, it's deeply integrated. Real-time patient monitoring, treatments based on your genetic data, AI making forecasts. It's a constantly expanding frontier, way beyond just keeping records.
The rapid evolution, it didn't happen in a vacuum, right?
Yeah.
Who are the key people, the organizations really driving this?
Yeah, the study looked into that too. They identified the most prolific authors, the ones publishing the most, and also the most co-cited authors, the ones whose work is referenced most often by others. They found over 100 authors they called prolific, meaning at least 5 publications each. And interestingly, most of that activity happened after 2015.
So a lot of recent activity. Any particular names or groups really pushing the envelope lately?
Well, a researcher named Tomilesa C. comes out on top with a significant number of recent papers suggesting a really strong current impact. And then you have Radic J, Radic M, and Vukovic M. They publish a lot, often together, especially in the last couple of years. So yeah, quite a bit of recent momentum from specific groups.
Interesting. But you also mentioned someone, Kaletzen K, with work going way back to 1977. How does research that old stay so relevant today? Is it the core ideas, or are the findings still directly used in, modern digital systems?
That's a really important point. Kaletzen K has been contributing for decades, a real pioneer. Their work laid down some fundamental theoretical and practical groundwork, concepts that today's advancements are still building on. It just shows, that today's cutting-edge stuff didn't just appear out of nowhere. It's standing on the shoulders of people who started thinking about this decades ago.
Right.
So it's not just about who publishes the most now, but the lasting relevance and the innovation a paper brings whenever it was published.
That makes sense. That historical perspective is crucial. Now, you mentioned co-cited authors. And you said something fascinating, that the top authors aren't always people. Sometimes they're organizations.
Exactly. Right at the top, cited hundreds of times, is the World Health Organization, the WHO.
Ah, okay.
They set global health standards, right? So their publications, like their global strategy on digital health for 2020, 2025, they become fundamental reference points. They literally shape international research directions and policies. It shows their huge influence.
That's massive influence.
Yeah.
Who else has that kind of pull?
Another big one is the European Commission. Also cited over 100 times. They're key in developing Europe-wide policies for digital health. Things like the Digital Single Market Strategy, the Digital Health Action Plan. Their documents guide a lot of research and development across Europe. Then you do have influential individuals. Amar D. is cited a lot for work on telemedicine, AI and diagnostics, personalized treatments, big data and decision-making. Kuhn S. explored things like 3D applications for personalized implants, surgery planning, using AI there. And Greenhalgh T. contributed a lot on how to actually implement digital innovations, assessing how digitally mature hospitals are.
So it's a mix then. Policy bodies setting frameworks and individual researchers pushing specific scientific frontiers.
Precisely. These co-citations really map out the intellectual structure of the field, showing the core ideas and the key players, both organizational and individual.
Right. If we connect this to the bigger picture, this digital shift isn't just happening in one lab or one country. Where is the research actually concentrated? Which countries are really leading the charge?
Okay, geographically speaking, the study found Germany leads by quite a margin in terms of publications.
Germany, okay. That makes sense given their engineering reputation.
Yeah, and it seems to point to a whole national strategy, big investments, a strong healthcare system, top universities, lots of international collaboration. They have initiatives like Digital Health Germany. It seems like a core focus for them.
So Germany's out front. Who's following? Any surprises in the rankings?
Well, perhaps surprisingly, Romania actually has a very high number of publications. The study suggests this is down to increased academic interest and real efforts to use digital tools to improve accessibility and efficiency. And they're getting support from the European digital agenda, too. It really shows this isn't just a big country game. Significant work is happening in diverse places.
That is interesting. What about the U.S.?
The U.S. is up there, of course. But maybe lower in the specific studies count than you might expect could be how things were categorized. But U.S. universities, big tech companies like Microsoft, Google Health, they're definitely still major innovators, just maybe publishing in different ways or journals not captured identically here.
Okay. And China?
China's a major player too. Huge government investments in AI and digital health generally. Big push for digital transformation there.
So the expected heavy hitters, but
Mhm.
also some really interesting contributions from places like Romania.
Exactly. And you also see strong contributions from Italy, the UK. They have their own national strategies. Switzerland, the Netherlands, known for high-quality, patient-focused work, even though they're smaller countries. Russia and Austria also show solid commitment. It's a truly global picture, reflecting different national priorities, tech capabilities, even local health challenges driving innovation. A worldwide effort, really.
And drilling down from countries to specific institutions, which universities or research centers are collaborating the most, leading the charge?
Charité University Medicine in Berlin comes out on top there. Big institution, known for extensive research networks, global reach.
Like tying back to Germany's lead.
Exactly. But again, Romanian institutions feature really prominently. The University of Agronomic Sciences and Veterinary Medicine in Bucharest, Uli Haiganu University in Cluj-Napoca, both very active, lots of international projects. Carol Davila University in Bucharest is also notable, even collaborating with places like Johns Hopkins in the US. It just reinforces that innovative hubs are spread out, not just in the traditionally dominant research nations.
Okay, so we've got a sense of who's doing the research and where, but what are they actually researching? What are the hot topics, the buzzwords? And did the study find any surprises in the most impactful papers?
Yeah, they looked at keywords, found hundreds that were used frequently out of almost 12,000 total keywords identified across all the papers. That gives a pretty clear map of the main themes. Obviously, digitalization itself is central. That underpins everything, this shift through EHRs, automated processes. That's the core concept.
Right, and what are the key technologies built on that foundation?
The big pillars are clearly artificial intelligence and machine learning. They pop up constantly, used for diagnosis, analyzing images, personalizing treatments. And these techs are what makes sense of big data, helping streamline decisions, speed up discovery. So yeah, AI and big data are everywhere in this field.
Makes sense. What about topics related to getting care to patients, especially thinking about recent years?
That's where telemedicine and COVID-19 are huge keywords. Telemedicine just became essential during the pandemic, didn't it? Really showed how tech can extend healthcare access, keep things going in a crisis, proved its value.
Yeah, found.
And underpinning it all, you see keywords like health, care, and management. Those remind us of the primary goals. Better patient care, smarter use of resources.
And the practical side, building the systems, getting them working.
Yep. Keywords like technology, digital health, e-health point to the infrastructure needed, and terms like system, implementation, model show the focus on planning, on strategy. How do we actually do this effectively? But crucially, the analysis also highlighted keywords like risk and challenges. It's not all smooth sailing.
Ah, the reality check.
Exactly. It reminds us that digital health has big hurdles. Data privacy is huge. Algorithmic fairness, making sure AI isn't biased, high costs of putting these systems in place, and just, human resistance to change. These factors are just as critical as the tech itself.
That's a really important point to balance the excitement. Okay, so that covers the buzzwords and challenges. What about the most cited papers? I'm guessing these are the recent groundbreaking AI studies everyone's talking about.
Well, here's another fascinating twist. The most cited papers identified in this analysis, they aren't always directly about digitalization itself. Many are actually older foundational medical studies.
Really? Older papers. How do they connect so strongly to modern digital health?
It's because their findings are fundamental to what digital tools are now trying to achieve or manage. Take the most cited one, inactivation of digoxin by the gut flora, reversal by antibiotic therapy from 1981.
1981. How does gut flora and an old drug relate to digital health?
Because today's digital tools, AI diagnostics, personalized medicine platforms, they need to understand and account for individual patient factors, like their gut microbiome, to be effective. That 1981 paper explored exactly that kind of biological interaction. So digital platforms are now leveraging that deep biological knowledge discovered decades ago to deliver truly personalized digital treatments or monitoring. It's about the underlying science that digital tools can now interact with precisely.
Wow, okay, so the old science provides the biological what, and the new digital tech provides the how to measure or influence it precisely. That's a great example of that synergy. Any others like that?
Absolutely. Another highly cited one, more recent this time, is Healthcare Professionals' Competence in Digitalization from 2019, that directly tackles the human element, the skills needed to actually use these tools effectively.
Right, critical for implementation.
And another, In Situ Bioprinting from Benchside to Bedside from 2020, that explores an emerging tech integrating automation and digitalization to potentially revolutionize treatments like, printing tissues or organs directly where needed. It shows that forward-looking integration.
So, pulling this all together, what's the big picture takeaway? This deep dive really shows digitalization isn't just a buzzword in medicine. It's genuinely transforming healthcare, right?
Yeah.
How we manage data, treatment services. We've seen this incredible international collaboration, super fast tech adoption, amazing potential AI diagnostics, personalized medicine, telemedicine reaching everywhere. It's all built on decades of solid science.
Definitely. But it's also crystal clear that there are ongoing challenges, regulations struggling to keep up, huge concerns about information security, data privacy, and this critical need to continuously train doctors, nurses, everyone to actually use these powerful new tools effectively and ethically. Which really brings up a key question, doesn't it? How do we best bridge that gap? The gap between the super fast tech innovation and the very real practical, ethical, and educational needs of a healthcare system that still needs to be fundamentally human-centered.
That is the crucial question. And it leaves us, and you the listener, with a lot to think about. As digital medicine keeps evolving at this pace, maybe consider what part of your own health journey could most benefit from some smart technology? And just as importantly, what concerns would you have about that integration? Something to mull over until our next deep dive.